to introduce our next speaker, Dr. Kyle Hill from the University of Minnesota. I'll wait for that to go away. Yeah, and Dr. Hill is going to speak about the heat impacts on mental health. Over to you.
Yeah, good morning, everybody. I hope you all can hear me. Let me get my presentation set up here.
Yep.
It should be, can you all see this?
Yes, we see
good?
the
Okay, cool.
presenter
Awesome.
mode.
Oh, you see presenter mode. All right.
Yeah.
Let me see here.
I think the little swap displays on the top left of your
Oh,
screen.
is it? Okay, cool.
I think that should do it.
All right.
There we go.
Here we go. Is that everybody got it? All right, cool. All right, let me get back to the first slide. Yeah, so very grateful to be here. Thank you for the opportunity and the invitation, Christine, especially as we met at the Climate and Health Conference in DC or Arlington. Today, I'll be talking briefly just about some climate mental health impacts to Indigenous communities. I'm an assistant professor at the University of Minnesota in the School of Public Health, Division of Environmental Health Sciences. I'm enrolled in the Turtle Mountain Band of Ojibwe and a lineal descendant, which is my father's enrolled in the Siston and Cheyenne River Sioux tribes. And so just moving forward here, I really like to put this slide first. University of Minnesota is a land grant university on really like stolen land from our Dakota peoples. And so we live here. I live in Amnesiaska, which is St. Paul, Minnesota. And so I really appreciate this map because it shows the original place names from our Dakota peoples. And if you can see the water, the blue space there is the origin of our tribal communities and our peoples. So I really appreciate that. And when we think about climate change, especially in Indigenous communities, we have to appreciate the intersection of social and ecological determinants. And this is primarily rooted in the colonial subjugation of Indigenous communities. And so if you see here on this slide in the red box, you see that the amount of aggregate coexistent of lands dispossessed for Indigenous communities in the US was 98 or is 98.9%. And so when we think about the really important and critical mandate for climate scientists, our society to engage Indigenous communities to support traditional ecological knowledges for adaptation and mitigation programming, we have to understand that, you know, our Indigenous communities are sitting on only 1.1% of their original homelands. And the lands that they're actually sitting on, if you look below here, are more exposed to more extreme heat, less precipitation than their historical homeland. So if you think about that westward movement, it was very purposeful, and the architecture behind that was to get Indigenous communities away from their lands that were highly sought after. So when we think about beautiful waters, big mountains and stuff like that. And so I think when you go lower in that red box, you see that the average forced migration distance for Indigenous communities here in the US was 239 kilometers, right? And I think there's tribes and Indigenous communities in New Mexico that also went on like the Baton Death March and some of these marches. And I think some of the another one is like the Trail of Tears, and some of these marches and moves and movements away from their traditional homelands went as far as 2,774 kilometers. Just to put into perspective about how long, you know, some of our communities had to move from utilizing their traditional knowledge systems, acknowledging that connectedness to lands. And so me being an Anishinaabe, this is one of our migrations, which was really out of a vision from our community members from the East Coast all the way to what's the Midwest or Great Lakes region. And so what the concern was moving away because you know, there's concern about our communities being able to survive on the East Coast with the impending, you know, coming in of settlers. And so here are I guess the vision was to move to where food grows on water. And so we ended up here in the Great Lakes. And wild rice was really, so that's a staple for us spiritually and culturally. But what you see now is that surface water temperatures are increasing in these same Great Lakes that we kind of traveled on, that these are kind of spiritually important to our peoples. And I say this because this is consistent with a lot of other indigenous and tribal communities, that their sacred places are under threat, often from rising temperatures, from drought and heat waves. For us here, it just happens to be our lakes and our waterways, and of course in Minnesota, we're the land of 10,000 lakes, and actually it's like 11,000 or something. And at the same time, we see ice cover duration is decreasing year over year, which makes a lot of sense if the water temperature is increasing. And so going towards this idea from an Indigenous perspective of climate justice and resilience, I just want to point out a couple of these before I share the following slides. Number one is articulating Indigenous conceptualizations on and approaches to health. And this is consistent with what we see in the Intergovernmental Panel on Climate Change, the IPCC reports, the Fifth National Climate Assessment, all of these things, right? And even more so, it's not only that, it's also an interdisciplinary approach, or braiding like Western scientific approaches to, early warning signs for climate systems, GIS mapping, all these things, while engaging tribal communities to recognize Indigenous knowledges. And so I just wanted to point out with that a couple of more recent reports that came out. The first one is the Status of Climate Change Report, Volume 2, which came out, I think, in April 15, 2025. I was an author on one of the chapters, co-author on the chapters. And essentially, the key messages here for this entire report, this is the second report, the first one came out in 2021, was that we need to acknowledge and engage respectful reciprocal relationships with our human and non-human relatives. This is essential for harmony and balance, particularly when we do climate science, when we're looking at mitigation and adaptation work. Second, Indigenous philosophies and Indigenous knowledge systems are essential in responses to the climate crisis that help support and guarantee sustainable futures. And one in particular, the bottom line says for the next 7 generations. And I think that's key here is a lot of our communities think about, not only what's in front of us, but what's happened in the past 3 generations and 3 generations forward. And so when we approach climate mitigation, adaptation, we have to think, how is this sustainable, from where we came from where we're at now. And so I really appreciate that key message. So I added the link to that as I'll send the slides around. And the first, I like this framework, just to frame the overall message here. This was from the first climate report that they put out. But essentially, this provides a framework for acknowledging how do Indigenous communities think about this crisis, in the context of climate change. Well, we have this guidance ancestrally. We have the 7 generation thinking and hope for our future generations. We consider the impacts of colonialism, in every way that people move. But with that is this impacts of climate change. In both of those, we think about together, right? We think about the globalization of our food systems. We think about the destruction of fossil fuel industries and extractive industries, and the things happening now. And so Robbie had alluded to this earlier, or Dr. Parks, but last year, in the past couple of years, I was really pleased and honored to be a part of this Indigenous mental health and climate change dialogue and research and action report. And so we finished that up. And so some of the priority research themes that were in this report were, one, understanding the mental health effects of climate-related disruptions to traditional practices, rituals, sacred sites, and connections to the land. 2, exploring how various factors, such as intergenerational trauma, stemming from colonial violence, kind of compound stress. So you have that intersectionality there. and then exploring how to integrate ancestral and traditional medicine approaches into co-created adaptation and mitigation programming, especially as it relates to mental health interventions. Of course, understanding the impact of territorial sovereignty on mental health in the context of climate change and the barriers to climate mental health support. Now, all of these together, I think we think about things like ecological grief, right? We think about the impacts on our homelands that are happening in front of us. But there's some promising initiatives too. Like here we see a picture of buffalo grazing, but there's a lot of efforts going into buffalo restoration practices that are akin to nature-based solutions, which are actions to protect, sustainably manage, and restore natural or modified ecosystems. And some of the examples of this, aside from buffalo restoration, is other types of land conservation, habitat restoration, reforestation, developing greenways. But the benefits are really climate mitigation, so enhancing carbon sequestration, improving water quality, some of these things. But one that's particularly important for us up here in the Midwest and Great Lakes is the buffalo restoration practices. Now, this is just a picture of some work that we have ongoing. This is a Climate Change and Health P20, which is a developmental center grant. It hasn't gotten canceled yet, but I just wanted to put this up there because one of the things we're doing is we're following up that research and action agenda, and we're doing our own regional climate change and health, Indigenous health research agenda here, and we're actually recruiting for that right now. Other than that, I guess that's it. This is us actually harvesting wild rice. Again, as you saw before, that's still a sovereign right and practice for us. And that's the Lake Superior on the side there. But other than that, I'll take questions and just appreciate the opportunity to be here, Gwitch.
Great. Thank you so much for that presentation. I've got a few questions. So can you talk specifically about how the health community can support a lot of these nature-based solutions and just transitions that you mentioned, especially in solidarity with tribal communities?
For sure. I think what you saw there in the climate change and mental health research and action agenda is one of those bullet points was how, one of the key recommendations for that is, and research areas was how do we support also health systems to organize efforts and resource traditional healing and land-based healing within our health systems. Right, because what we're noticing now, and I think what the science is pointing us to, and I think what our elders are saying is that, the land is healthy if we're healthy, and vice versa. If the land's healthy, we're healthy. And so how do we co-create these mitigation strategies that offer us some co-benefits here, right? And so we're it's become too rote for us to try to heal in these little boxes, which are our offices in a hospital or clinic, especially our mental health approaches, right? And as I used to be a clinical psychologist. I guess I still am, but there's a discomfort with that for Indigenous peoples because it's like, we're used to being out on the land, or at least that's who we are. And so, I think there's opportunities. There was recently with CMS or Medicaid, Medicare, there was an expansion to where some states were afforded the opportunity to have traditional healing inside of their, I think South Dakota and some other states inside of their clinics and hospitals and stuff like that. So we're moving in that direction, but I can tell you it's been a long slog. Yeah.
Great. Thank you so much. And those reports that you shared on the slides, if you have a link that you could put in the chat, I'm sure a lot of our participants would love to read them.
I will put the reports in the chat, and then you'll have my slides as well.
Amazing. Thank you so much, Dr. Hill. All right. So we've come